Hey guys, I know how much an arthritic, painful, stiff spine can hinder you in everyday life. So I'm going to show you 3 exercises that help to change my spine's mobility. And I was someone that was suffering from daily ankylosing spondylitis. I was diagnosed more than 12 years ago. And now I'm a professional dancer and I teach movement and holistic health. So let's get right into it. Here are 3 exercises that are going to change your spine's mobility forever if you stay consistent. Let's go. The first exercise is called an open and close. We are going to be taking the spine into flexion and extension. So you're going to be pushing your hands into your chest, rounding your back as much as you can, but not forcing, and then opening and breathing in. And we're going to be pushing our hands in our chest, rounding the middle of the spine, and then opening and breathing in. And then breathing out, breathing in, breathing out, breathing in, breathing out, breathing in. So what happens and why this exercise is so important, because the spine starts to calcify and round when you have ankylosing spondylitis. It's very important to take the spine back through extension, but we want to be gentle and use our breath, and then we want to push and take our spine through flexion. This is going to help open up all the little facet joints in our spinal column and then help expand them or release them this way with the breath supporting. That is exercise 1. Make sure you do this one. It's important. You can do it every second day, maybe 2 sets of 20 to start with, and then you can progress to a little bit of a harder exercise. This is scalable for everybody. So even if you just do really small ones, that is okay. That's how you're meant to start. And then eventually you can really open up and really curl. But at the start, you want to feel minimal to no pain at all. The next exercise is called an axial rotation. This is one of my favorites because it's starting to teach the spine how to twist. So what you do is you have your arms by your side and they're very nice and loose. So you don't want to be stiff like this. You know, you want to try to loosen your arms, be very soft in the arms, and then you're just going to spin and allow the arms like soft, long spaghettis or soft noodles. They're just going to be slapping the lower back. And you're going to be turning your head to follow. So what this is doing, this is corkscrewing your spine very gently. It's bringing in some twisting motion or rotational motion, which is very important to lubricate the spinal column. And when we have things like ankylosing spondylitis or rheumatoid arthritis or any other type of joint dysfunction, the tissues get dry, and rotation brings fluid, it brings blood, it brings oxygen. So this is crucial. This is one of the things that really helped me. I'm just going to turn around so you can see what it looks like from behind. So I'm trying to turn my neck and my head to look all the way behind me and keeping the arms really soft and light. I'm not doing this. This is very different. My arms are super loose and I'm just gently slapping. And it can be very gentle. It can be like this to start with. We just want to rotate the spine. It's really important. That's exercise 2. The third exercise is going to bring some side bending into our spine. So we're going to hit all 3 planes of spinal movement. So we're going to put our arms onto the wall and we're just going to turn them from side to side. And we're going to do about 20 reps. We're not trying to push the hips out too much. We're just trying to bend from the middle of the spine. This is going to help with your thoracic spine, which is the center part of the spine. We're not trying to get too much lumbar happening because this is cheating. It's using our hips. We just want to move the spine only. From left to right, thinking of your side bending. You're putting each side into a little bit of compression. And you can go gentle. You can go this much. If your spine doesn't want to move too much, you can go nice and light, nice and gentle. So just focusing on this and just spending a little bit of time here. Once again, I would recommend doing maybe every second or third day this one, and maybe 20 reps, 2 sets. I hope you enjoy. These are exercises that helped me so much. I am pretty much symptom-free of ankylosing spondylitis, even though I thought I would have it for life. I didn't take any medication for it. I was lucky that I met some incredible people. If you need more assistance on your journey with dealing with any chronic illness. This is what I do for a living. I involve movement, nutrition, mindset, and emotional work, which is all primary things that are going to help you with recovering and feeling light and free and great. That's Simba checking out.